Thank you very much, Ciara, and you're very welcome to the House, Minister. It's great to see you. I think it's the first time I've had the privilege of speaking to you in the chamber. This morning I'm bringing this commencement matter on breast cancer services and in general cancer screening in general, and it's a huge concern to me. I'm afraid right now people are not getting screened due to the restrictions occurring from the pandemic, and understandably so, but therefore people are not getting the cancer treatment they need. We must make certain that we as a government minister ensure that the resumption and the continuation of cancer screening services are adequately resourced in the system so we can catch up on screening. Minister, more specifically, the reason why I raise this commencement matter today is to highlight breast cancer screening and the fact that the NSS advised the current round of screening, which is usually 24 months, will now potentially take 36 months due to the impact of COVID. To highlight the prevalence of breast cancer, is 1 in 9 women in Ireland will get diagnosed with breast cancer. It is the second most prevalent cancer in the world, and in 2016 85,500 people died from breast cancer in Europe. It is a huge worry and a huge concern of mine. Minister, I am hearing from so many women at the minute, because of the lack of capacity in the system, that if they choose to pay, and we hear again Senator Conway speaking about, if you can choose to pay, you can get the health service you need. And this two-tier system, again, it is intolerable, and it highlights again, as Senator Conway was saying, the need for universal healthcare in the country. An individual's health should not be disadvantaged by their ability to pay. And we need to look at the capacity of private screening, because I know, Minister, if you want a private screening, you can get it within a week. And not have to wait, and we need to expand that private screening capacity for the benefit of our public patients. And also, Minister, I've been working with Councillor Teresa Costello, who is a member of the Dublin City Council, and I commend her on her incredible work. She is a young woman who is a breast cancer survivor. She set up one of the largest support communities for breast cancer patients in the country, called Breast Friends. And she would like me to highlight today, on her behalf, all the women in the country, that because on behalf of all the women in the country, that more and more younger women are being diagnosed with breast cancer. 30% of all women who get breast cancer diagnosis are between the ages of 20 and 50. 34% of the women are diagnosed are between 50 and 69, and 36% are older than 70. And as you know, Minister, the screening age is only between 50 and 69. And Minister, we're missing and not screening for 66% of our breast cancer. And I really urge you to bring back this to the Minister, that we do expand that screening capacity to take in from women from 40 years, at least 40 years up. And I also ask that there would be an awareness campaign on breast cancer awareness, so young women are empowered, and older women, every woman is empowered to be able to check for themselves, to check manually, that they can, and that possibly the GPs would work with the department to provide for that manual check and that automatic ability to be able to get a mammogram under 50 years of age. Because if you have that concern, you're not automatically sent to breast check, and that is a real issue for me and an awful lot of women. To sum up, Minister, I really appreciate if we could bring those notes back to the Minister, screening enhancement for all women, and a manual check, an awareness campaign, and a GP to do a manual check also. Thank you.
Thank you, Senator. Minister, you have up to 4 minutes in reply.
Thank you, Ciara. Well, firstly, I'd like to thank Senator McGreehan for giving me the opportunity to update the House on this important matter on behalf of Minister Donnelly. The Government fully support and are committed to supporting our population screening programmes, which are a valuable part of our health service. As you know, Breast Check, along with other cancer screening programmes, was temporarily paused last year due to the impact of COVID-19 on both our health services and our communities. While Breast Check resumed in October 2020, unfortunately it had to be paused again, issuing new invitations in January-February this year. I am pleased to inform that it has resumed again last month, with over 8,000 participants screened. The programme has done a huge amount of work to support the safe resumption of screening by taking measures to reduce the risk of COVID-19 infection to the participants and staff. The focus of the resumption of breast screening includes the management of capacity across the whole of screening pathway, which includes follow-up assessments and treatments. I would like to note that even when screening was paused, the programme continued to operate follow-up clinics. Breast screening involves close contact between staff and participants, and with COVID-19 safety measures in place, obviously it will take longer to get through the current screening round. However, in Ireland, we are fortunate that we screen more frequently than many European countries, meaning that it is expected we will still be in line with international norms for breast screening. An additional €10 million has been provided in 2021 for cancer screening service in the HSE National Service Plan. One important initiative prioritised for 2021 is the development and opening of semi-permanent breast check units in 2 locations. These new units and the recruitment of more staff will help to enhance the capacity of the programme. In line with the commitments in the programme for government, BreastCheck is currently implementing an age extension programme that will see all women aged between 50 and 69 years being invited for routine breast screening. In relation to consideration for any further age changes, such as reducing the age to people under the age of 50, as the Senator has suggested, it is vital we remember that breast screening is a population health screening measure. It is not an individual diagnostic test. The balance between the benefits of screening and the potential harms or risks to the population as a whole require careful, evidence-based consideration and balancing. As with all national screening programmes, BreastCheck delivers its services in line with international criteria for population-based screening programmes that are kept under constant review. Decisions about changes to our national screening programmes will be made on the advice of our National Screening Advisory Committee. This independent expert group considers the evidence for changes in a robust and transparent manner. This ensures policy decisions are informed by the best available evidence and advice. It may be of interest that the committee recently published their first annual report, which is available on the Department of Health's website. BreastCheck provides lots of information for the public on its website, breastcheck.ie. This includes educational materials to encourage women to be aware of general breast health and, crucially, the common symptoms they should seek medical advice for. They run social and digital media campaigns and provide valuable information on their website, including regular updates in relation to COVID-19. I would like to take this opportunity to emphasise that screening is for healthy people who do not have symptoms. People who are between screening appointments or are waiting for rescheduled appointments are asked to be aware of symptoms, and if they have concerns or worries, they should contact their GP, who will arrange appropriate follow-up care. In light of all this, I trust the public can be assured that the Government is committed to our national screening programmes.
Thank you very much, Minister. And absolutely, I do welcome that additional 10 million. I am very aware of the development and the increased funding in the breast and cancer services. I do understand that there is a benefit of the balance of benefits between screening and the potential harms, but I do think that at the minute, because they're not being automatically screened, there's a lot of breast cancers not being diagnosed, and it is unfortunately on a very brief research and talking to breast cancer survivors and patients, that younger people are, because they're being diagnosed at a later date, because they're not getting that screening, they are diagnosed with stage 4, and often a lot of them are incurable. So I do think that yes, there is very helpful information on the websites, but I do think we need to bring that information more to women, to highlight to women, to empower women, young girls, how to check themselves. Because I know, Minister, I certainly wouldn't be 100% on how to check myself. So we do have to be to know that, and that just because you're not being screened, or you're not in that category, that GPs know, and they have an option to send on and request for that mammogram and that check. So I thank you very much. I thank you for your time, Minister, and I hope you relay those things back to our Minister Donnelly. Thank you.
Thanks, Minister Graham. Minister.
Thank you, Senator McGreehan. And I think you've put a very strong case forward, and I guarantee you that I will relay your suggestions back to Minister Donnelly. And I think you have, to be fair, acknowledged the additional 10 million investment in the National Screening Service this year, and that I think demonstrates the real commitment by this government to national cancer screening services. I too also want to compliment and take the opportunity to compliment Councillor Teresa Costello for the really good advocacy work that she has been doing. And I suppose it takes real guts and commitment for somebody who has come through what she has come through to turn a negative into a positive. And she has been a real strong advocate, and I want to acknowledge that on the floor of the House. And as I said, I commit to relaying back to Minister Donnelly the points that you raised here today.